Hello, everyone. I'm Sherry with the CGH Health Foundation, and welcome to our Growing Healthier program for July. This educational series is sponsored by the CGH Health Foundation, and it gives us an opportunity to introduce you to some of our amazing healthcare professionals. And our programs are hosted by Dr. Bill Bird. Today, our program is called Inside Neurology, Understanding the Nervous System, and we have the opportunity to introduce you to our new neurologist, Dr. Brian Ansu. And Dr. Bird and Dr. Ansu will be talking about how neurologists diagnose and treat conditions that affect the brain and the nerve, things like migraines and Parkinson's and seizures and stroke. Before we get to the program, I do have some information about some CGH Health Foundation events. You have probably seen or heard of our therapy dog program, and we love our therapy dogs, and we would like to have more therapy dogs. So we have temperament testing coming up. And so if you have a dog that has been through obedience training and you would like to share your dog with our patients and other visitors, you can come to our temperance testing and we'll see if your dog is a good fit for the program. We have two opportunities. They are on August 3rd and August 20th, and we don't take walk-ins for those. You do have to have an appointment or fill out an application for that testing. And so you can do that by calling 815-625-0400 extension 5618, or you can actually find the application on our website at www.cghmc.com/dogs. The summer is flying by, and in no time, it'll be time for our Delicious Designs auction. And the auction is actually going to be from October 19th through the 25th. At this time, we're looking for sponsors, and we'd love to partner with you, your business or organization. And we have 3 levels of sponsorship available. We would love to partner with you, as I said. And so if you would like more information about that, you can give us a call and talk to either Amanda, and that is 815-625-0400 extension 5672, or to Sierra, and her extension is 5575. Let me tell you about next month's program so you can put that on your calendar. Dr. Bird's guest next month on Thursday, August 20th, will be Dr. Thomas King and also nurse practitioner Ellie Bullis from our Wound Healing Center. And we're going to be talking about healing that lasts and how understanding advanced wound healing. So difficult to treat wounds that might be caused by injury or diabetes, or infection as well. And so that program is going to be again on Thursday, August 20th here on Facebook Live at noon. And with that, I'll go ahead and turn it over to Dr. Bird if he's ready.
Oh, sure. Hi, Sherry. How's it going?
Good.
We need to do temperament testing for all of our employees, huh? When we get them hired on. What do you think? I'm not getting anything from Sherry. Anyhow, hi, this is Bill Bird, Chief Medical Officer at CGH Medical Center in Sterling, Illinois. And I would say the temperament of our employees is very good. So anyhow, we are going to talk neurology today with Dr. Brian Ansu. And Dr. Ansu has been with us now for a couple months, and he's been a joy to work with, and he's hearing really good things about his work with patients. So without further ado, let's get Dr. Ansu on the line here. Hey, hi, Dr. Ansu.
Good afternoon.
How are you today?
I'm doing well, thanks.
Good. Are you up for a few questions?
I sure am. Anything you got, just throw it at me.
All right. So I usually start for folks that are new to our organization, for people who are watching, just to get a sense of who you are. Just tell us a little bit about yourself.
All right. Well, I grew up just south of the Quad Cities, a small town called New Windsor. It's about 600 people. I still live there now on our family farm. I kind of grew up in a family of technical workers, laborers, electricians, plumbers, HVAC. So growing up, that's kind of where I felt my future in life was going to be. Matter of fact, when I graduated high school, I became a welder, a certified welder, and I welded for about 6 months until my dad died, and
Mm.
that's what changed my life, to pick another avenue to go down. So he was diagnosed with a rare disease at the time. This was back in the 1970s, a disease that nobody ever heard of before. He was 55 years old. The disease was called Alzheimer's. And through that time, over the past 8 years that he lived, he died 6 months after I graduated from high school. Even at that time, nobody knew what Alzheimer's was. And the morning after he had passed away, I decided I was going to change my life and try to help people and change the course of things. So that kind of what took me through this journey of medicine.
Mm.
And I've been practicing now for some time. Like you said, I just joined here for 2 months. When we see the neurological diseases, they're becoming more and more prevalent. And, there's a lot of things that we can do to try to offset the course of these things, just because of the fact that they're so devastating for families, so devastating to the patient.
Yeah.
So that's kind of what my mission is.
Okay. That was pretty clear to me. That would be a compelling reason to move forward into neurology.
I still have a welder.
I bet you could do that just fine. Yeah.
Yeah, that's true.
All right. So Brian, one of the things that you do that is been very helpful, and it'll be more and more helpful as time goes by here for patients, is you do something called EMGs. Can you kind of talk about what those are and how those are helpful for helping to figure out what patients have going on with them from a neurological standpoint?
Yeah, when I completed my residency in neurology, I did a fellowship in what we call clinical neurophysiology, and that is the study of pretty much the peripheral nervous system and the muscles, how they work together. And one of the tests that we use to help diagnose conditions of the peripheral nervous system is a study called EMG. It's electromyography and nerve conduction tests. So when you look at the peripheral nervous system, you could think of a peripheral nerve just like a wire in your house. You have the copper wire, and then you got insulation that covers that wire. And just like the wire in your house, if that insulation comes off, you get a short circuit and it doesn't function. If it goes to a light, your light will flicker. It might not work at all. And the nervous system is basically set up on that same type of thing. So the human nerve is got an axon, which is essentially the copper wire, and the insulation that surrounds that copper wire is called myelin. And if that myelin is defective, it doesn't carry the current down to where it needs to go, which in the human body is the muscle. So when we look at the diagnosis of different disease, and especially as prevalent as diabetes is, which diabetic neuropathy is it's the most common kind of neuropathy. So we want to look at how it is affecting the nerves. So when we do what we call the nerve conduction study, what we do is we put 2 little electrodes on the muscle where that nerve goes to and administer a little bit of a shock to that nerve with a little probe. And then we measure the distance that electrical shock has to travel before it gets to the electrodes. And we can determine how fast that current is moving through that nerve. And we have normal data that says that it should be going a certain speed, typically around 45 to 50 meters per second, which is relatively fast when you're looking at a distance of only, inches. So when we give that shock, if that nerve is going fast, we know that the insulation is good. Now, if the insulation has holes in it where we're getting some leaking of the current, it's going to slow the current down. And so the speed of that nerve is going to be slowed. But if the copper inside of that nerve or the axon is affected, when we give you that electrical shock, we know exactly by the machine how much current I gave you in that shock. So at the end of that nerve, that current should come out the same strength. it doesn't, if the current drops over that distance, then we know it's an axon or axonal issue.
Okay.
So we put those together. It's either a peripheral neuropathy being demyelinating the insulation, or the copper center or the wire of the nerve, which would be axonal. And you can have conditions that will affect both the axon or the inside and the insulation, the myelin. And then what we can do on certain things, like the upper extremities, if we're looking for somebody that has numbness and tingling in the hands that wakes them up at night and they use a drill all day at work, it could be a compression neuropathy like carpal tunnel. So we can map out the speed of that nerve as it goes along its course through the arm and see exactly if it's slowed across. In the example of carpal tunnel, if it goes slow across the wrist, then we know we got a compression issue there. We can also find out if somebody comes in with back pain or neck pain, is that issue coming from the neck? And in that part, we use this very small little needle and we insert it into the muscle, and we actually listen to the nerve and the muscle communicating with each other. So if somebody has a herniated disc, let's say in the neck, and we put that needle into the muscle, if that nerve root is being irritated, it irritates the nerve fiber. So we listen to a certain characteristic sound of that nerve fiber. And then we have other diseases like Lou Gehrig's disease. We see abnormalities throughout the muscle. We have muscle diseases like myopathies. We put the needle into the muscle and we listen to see how strong that contraction is of the muscle. So it seems like a pretty simple test. It's been around since the 1800s. It's just now the machines aren't the size of washers and dryers; they're the size of a laptop computer.
Yeah.
So it's really it's amazing how we can learn to see how the nerve and muscle is functioning, and it can really give us a clear idea of possibly what the diagnosis may be.
Yeah, great. And just for folks who are watching, it's one of the things that here at the hospital at CGH we've had it's tough to find enough doctors to take who can do EMGs to help patients out. So having Dr. Ansu being able to do that is going to be really helpful for patients to get that testing done, and then based upon that, see what's going on and then take action on whatever their condition is. Which leads me to my next question. And it's a pretty broad question. I'm going to open the floor to you, Brian.
Sure.
But I'm a family practice doc, and I can remember going through training, and as far as neurologists go, the comment was always like, well, I don't know that I want to do that, because you can come up with a diagnosis, but in terms of like, what can you do to help the patient? Not as much. And yet I see nowadays that in neurology, there actually are for a number of conditions, more and more options of ways to help people who are diagnosed with neurological conditions. And so I'm going to give you the floor to speak to maybe some common neurological conditions that there are treatments for now that there weren't even maybe a decade ago. So I'll give the floor to you.
Yeah, that's true. From 1990 to 2000, it was considered the decade of the brain. And just like you mentioned before, for the treatment, neurology used to be diagnose and adios. Essentially, we would tell a person what they had and tell the person there was nothing they could do about it. But over the decade of the brain, when so much research went into the neurosciences, we're seeing so much change. And even if you go back to the early 2000s, for multiple sclerosis, you had one or two medicines. Now there's probably 20. So we see so much advancements coming into just about every disease, even diseases like some of the ones that we would consider not treatable. And a lot of the diseases that we do treat, we treat symptomology. Like a perfect example is Parkinson's disease. and Alzheimer's. There's no cure for them, but if we could come up with a modality that slows the progression of these diseases down, and we've seen that now in Alzheimer's, we're seeing it, Parkinson's, and the ability to diagnose these diseases faster really gives us an edge on addressing, because not only are these medicines, but lifestyle changes, things like that, are so important. So we're seeing that across the whole board of the neurosciences.
I hear about these medications that are like the immunomedications, biologics, those kind of things. Can you talk a little bit about some treatments that are out there for conditions nowadays that maybe weren't there 10 years or so ago, as far as like infusions and that kind of stuff?
Yes, especially we're seeing this in the Alzheimer's world. Before we had two medications, or three, but they worked on the same principles. And now we have the infusions that actually slow the progression of disease down by decreasing some of the abnormal plaquing that occur in the brain. And these are things that we've never even could imagine. 10 years ago, there was rumors of stuff like this, but
Yeah.
we never even imagined something like this. We're looking at even like a common condition, migraine headaches. Some of the CGRPs that we're looking at that actually, instead of affecting the blood vessels, they block the beginning of a migraine or stop the migraine. So we're looking at, and we're seeing, I think this next month, there's some new medications that are hopefully going to be approved by the FDA. So I think we're looking at a lot of that as the future of medicine, changing the way that the body is reacting through either the immune system or the way at the nerve junction or the neurochemistry of the brain.
Yeah. Let's stay on migraines for a second. Talk a little bit about Botox injections and how that's helped out with patients who have migraines.
Yeah, Botox has been around for probably about 40 years. And we use it, or especially for me, we use it heavily in migraine headaches. And Botox as a botulism toxin is one of the most dangerous chemicals. I think it was one of the concerns that we had during the Iraq War, is purified Botox as a biological warfare agent. But when it's injected into the body, it's probably safer than Tylenol. And we use it a lot in migraine, especially in my practice. We give small injections with the Botox into areas around the face and also alongside the head and down to the back. And I mean, it's wonderful. I just saw a patient yesterday in our clinic here that had been suffering from headaches since, I believe, at like third or fourth grade, and has tried every medication. And she had her first treatment of Botox in February. And after about 2 weeks, she said that she realized, I don't have a headache anymore. And she's not had a headache since that time.
Oh, wow.
I mean, some of the responses of these things are unbelievable. Now, another utilization for Botox we use too is if somebody would have a stroke or traumatic brain injury where they have spasms of the muscles in the arms or the legs, spasticity, we can give the injection in the muscle to relax that. And the problem with spasticity is it can be very painful for those patients. So if they can relax that arm, it gives them a lot better quality of life. Also, in patients with Parkinson's disease and they have terrible drooling, we inject the Botox in the parotid and the sublingual glands, and it improves their drooling, which again is this life-changing experience, because some of these patients drool so much that, I mean, they have to carry a towel around with them
Mm.
So if you can improve that, just the quality of life. We use it for blood throw spasms where you can't keep your eyelids up. Uh,
Mm.
we use it for a lot of things. Other specialties, they use it in bladder
Mm.
issues. So, I mean, for a medication that they initially thought was going to be worthless, it's
Yeah.
to be so effective in so many cases.
Yeah. Yeah. How about multiple sclerosis? What's thought now to be the cause of it? And are there any treatments that are available that seem to help out patients? Because, yeah.
Yeah, like I said, when I first started my career, we had about two or three uh, treatment options: Betaseron, Avonex, and Copaxone. And now we have so many. We have, and all three of those medicines in the past have been injection, and they're frequent injection, once a week, 3 times a week, etc. And now we have so many options that pill form. We have infusions, twice a year infusions, um, which for a patient that has a condition like that, um, going from a weekly injection or a 3 times a week injection or take a pill every day to go in and get an infusion twice a year. It's just changed the life. And in addition to the types of multiple sclerosis, some of the other ones that we've never had treatments for, now we have treatments available for them.
Hmm.
So again, this has just really changed the whole treatment pattern of these conditions. Because multiple sclerosis, it can be pretty devastating. And I think with some of these modalities that we have now, really it's more of a disease that they say they have rather than being real disabled with it in most cases.
Yeah. 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 That's awesome. Any other neurological diseases that come to mind in terms of treatments that have been really beneficial as of recent?
Well, when we look at the most common neurological diseases, Parkinson's, especially in this area, we live in the Parkinson belt.
Hmm.
And so Parkinson is so prevalent around here and just through the whole Ohio, Mississippi valleys. Um, and it's quite a devastating disease. It's a progressive disease. There's no treatment for it. But some of the modalities that we used in the past, which have been pills, primarily Cinemet, which is dopamine, a dopamine supplement, which is the neurochemical that's lacking in a person with Parkinson's. And with that, you give that medicine, and in the beginning of the disease, that medicine, you take the pill and it lasts for 6 hours. As the disease progresses, that time that it lasts fluctuates. You may have 4 hours of what we call on time, meaning it's working, and the next day you may have 2 hours of on time.
Okay.
So now they've developed a pump that is very similar to the mechanism of the insulin pump. It's just a subcutaneous uh, uh, needle that goes into the skin, and it has a pump just like insulin, and it is just a continuous releasing dopamine. So
Huh.
you have these fluctuations of uptime and downtime, and it has just been amazing. Plus some of the other mechanisms of trying to make the dopamine work better.
Hmm.
And so we're looking at this. We have what we call deep brain stimulation, where we put a electrode down through the center of the brain, and it gives the brain an electrical charge that helps uh, alleviate some of the freezing or the tremors
Hmm.
that you see in typical Parkinson's.
Yeah. Very good. Okay. Well, I don't want to keep you too long. I know you have patients to go see today.
Sure.
But I have one other question before I let you go. What's you've been here now for a couple months?
Next month or next week will be my fourth or second month. Yeah.
Okay. Yeah.
Yeah.
I'm just curious. What's you're from a small town, so this isn't unique to you to be in a small town like this. But what's your experience been as you've met patients and staff and stuff like that here at CGH?
Well, one thing I realize, and I think I tell just about everybody this when I go, is it's such a beautiful hospital. The physical plan of it is just amazing how nice it is here. But what's even nicer than that is when you walk through the hospital and all the employees are smiling and happy. You don't see that in very many places in today's world. And it's just been tremendous how just how the employees of the whole system are so happy. And that is something. And I think a little bit has to do with it because it is a small community. You know, you're going to be treating somebody that is going to be a neighbor of somebody you know.
Mm.
And I think that's where you get that community effect where you don't get that in the large hospitals, especially when you go to the large corporate-owned hospitals where the nursing staff changes, and it doesn't seem like there's the personal, I should say, skin in the game. You're treating somebody that somebody knows.
Mm.
I think it just is better quality,
Yeah.
and the patients have been tremendous too.
Yeah. I'm so glad to hear that. And that's been my experience here at CGH as well, is that it's very much a community hospital with a capital C for community. So glad to hear that that's been your experience as well.
Yes.
Well, Dr. Ansu, thank you so much for your time. So glad to have you here. And there's a phone number if you need to make an appointment to see Dr. Ansu. That's the how you can get a hold of him. And we're so glad to have you here. And thank you for your time.
All right, I appreciate it. Thanks. Have a good weekend.
All right, yeah, you too. Bye.
You bet. Bye.
All right, I have a few slides I wanted to show before we let you go. Lyra Tafiku is our employee of the month for July. She works as a housekeeper, and really, I think she's a very worthy candidate. Speaking of friendly faces, very much so. So I'm glad that she has that honor. And just to remind you, next month we're going to talk about wound care, and we're going to have Dr. King, and we're going to have Ellie Bullis here to talk about all things wound related with you. Okay, I believe that covers it for this week. Thank you so much for taking the time to watch this, and of course share this with others if you find it helpful. Until next time, this is Bill Bird, Chief Medical Officer at CGH Medical Center. Thank you for watching.